Chemotherapy drugs are highly effective because they aggressively target fast-growing cancer cells. But that treatment also sweeps through healthy, fast-growing cells in your butt, mouth, and hair. The medicine fights the cancer, but the physical side effects fight you. It is easy to feel overwhelmed by that physical toll. Today, we're going to shift you out of that reactive state and help you build a personalized, written daily chemo care plan. We will break this down into 3 specific steps: setting a morning energy schedule, building a hydration and nausea strategy, and defining your emergency red flag checklist. Taking abstract medical advice from your doctor and translating it into a physical, step-by-step document takes the guesswork out of your day. It reduces anxiety and puts active control back in your hands. Grab your piece of paper and title the first section Morning Energy. It is tempting to fight chemo-induced fatigue by sleeping longer or taking extended naps. But relying entirely on rest is a trap that can actually backfire, leaving you feeling more sluggish. Instead, write down a plan to get sunlight exposure immediately after waking up. Natural light is a biological trigger that prompts your brain to reset your body's daily energy cycle. Next, note down that you will include a small source of protein with your breakfast to provide your body with a steady supply of fuel. Then, schedule a 10-minute slow walk. It sounds counterintuitive to walk when you are exhausted, but this gentle movement is essential. Short 10-minute bursts of activity physically prompt your muscles and cardiovascular system to wake up. Biologically, this does more to restore your energy levels than spending an extra hour in bed. By structuring your morning around these specific biological triggers, light, protein, and gentle movement, you prevent fatigue from dictating the momentum of your entire day. Now, start your second section, your hydration and nausea strategy. Your medical baseline here is strict. You need to consume 8 to 10 cups of liquid every single day during treatment. But there is a catch. If vomiting or sweating has left you severely depleted, drinking only plain water can actually worsen your dehydration. This split-screen diagram shows why. When you lose fluids, you also lose vital minerals called electrolytes, like sodium, potassium, and magnesium. These minerals are responsible for keeping your heart rhythm steady and your muscles working. As you can see on the left, without them, plain water can just pass straight through your digestive tract. Your body physically requires these minerals to absorb and retain fluid. When water is bound to those electrolyte minerals on the right, they successfully anchor to the gut lining, allowing the fluid to absorb into the surrounding tissue. Because of this, write down specific electrolyte-rich hydration sources on your plan. This could be sports drinks, Pedialyte, or specialized medical formulas designed for chemo patients, like Humalite. Right below your drinks, log the exact schedule for your prescribed anti-nausea medications. This requires a behavioral shift. You must take your medication strictly on its designated schedule before you feel sick. Do not wait to react to the nausea. Finally, add 2 dietary rules to this section. Eat small, frequent meals and prioritize cold foods. Cool items are physically easier to swallow and require less energy for your body to digest. Treating hydration and nausea as a proactive, rigidly scheduled chemical balance prevents the severe physical crashes that lead to unplanned hospital visits. For the third and final section of your plan, you are going to write down your emergency red flags. During chemotherapy, trying to tough it out is dangerous. You need clear, objective boundaries. Write down your first critical threshold. Call your care team if you physically cannot keep any fluids down for a full 24 hours. Your second threshold involves digestion. Log a reminder to call if you experience diarrhea more than 4 times within a single day. Next, identify your acute physical warning signs. Sudden dizziness, mental confusion, or a racing heartbeat all require immediate medical attention. Finally, write down your non-negotiable fever threshold, 100.4 degrees Fahrenheit or higher. Documenting these objective numerical triggers in advance removes the guesswork for both you and your caregivers. It ensures you get early interventions, keeping your core treatment right on track. You now have a complete customized plan, a proactive morning schedule, a scheduled hydration and nausea strategy, and an objective red flag checklist. Take this physical document and place it somewhere highly visible, like secured to your refrigerator or resting on your nightstand. Share this exact physical plan with your friends and family to create the shared system of accountability with your caregivers. Successfully managing side effects is a process of stacking small, manageable daily wins. Chemotherapy is a formidable physical challenge, but establishing a concrete daily plan provides the required foundation to endure and tolerate your treatment.